I'm Douglas Massi, and in this brief video, I'll be going over original Medicare in a way that's really clear and easy to understand, and how a Medicare Advantage plan may just be a better option that, well, could actually put money in a Medicare recipient's pocket and or offer more benefits than what is offered through original Medicare. And this video is perfect for those of you who are about to turn 65 and even you insurance agents out there, because I will be going over original Medicare versus Medicare Advantage in basic layman's terms that pretty much anyone can understand. Let's start by giving the video a thumbs up and subscribing. We're putting out new insurance sales and insurance information content every single week. When you or your client A turns 65, or B has end-stage renal disease, or C is legally disabled, you automatically qualify for Medicare Parts A and B as long as you or your spouse has worked and paid taxes in the United States for 10 years or longer. Basically, you must be eligible for and or entitled to Social Security benefits. Part A covers your hospital and a lot of other type of facility costs. Meanwhile, Part B takes over what I would say your typical health insurance would cover, doctor costs, specialists, preventative services, checkups, etc. When you become eligible for Medicare, it's important to sign up for both Parts A and Parts B within 90 days of eligibility, and here's why. As of 2022, Part B has a cost of $148.50 each month, which is automatically going to be taken out of the Social Security recipient's benefits, and like as soon as they sign up for that Part B. The longer the Social Security recipient delays signing up for Part B, the more the cost of this benefit will absolutely increase, because guess what, guys? Social Security will charge a penalty that the recipient has to pay for the rest of their life. What's worse, the longer you delay signing up, the more that lifetime penalty will cost every single month. Important, prescription drug costs are not included with original Medicare. In order for you to have either all of or at least most of your prescription drug costs taken care of, you will need to either pay for a prescription drug plan known as Medicare Part D, or you'll need to enroll in a Medicare Advantage plan that covers your prescription drugs. Either way, this is where you need a licensed insurance agent like me, which you can contact anytime by just calling the number below. And either I, myself, or one of our licensed insurance professionals will gladly answer any questions that you may have, and if need be, we can definitely educate you on exactly how Medicare works. Now let's talk about some of the reasons that some people may really want to consider enrolling into a Medicare Advantage plan. First, Medicare Advantage plans are private insurance plans that are covered through regular insurance carriers, and buyer beware. When you see those insurance commercials by those big companies, remember, their job is to sell you on a plan. The problem is that now you're speaking with someone on the phone who only has access to plans available through that specific company and could easily sell you on a plan that doesn't really cover your needs, or that maybe your doctor doesn't even take. Meanwhile, there might actually be other plans with other insurance companies, carriers, that might better cover and or better suit your specific needs. Okay, for instance, some plans will pay part of or all of that monthly Part B cost of the $148.50 that I mentioned earlier, along with the cost of prescription drugs and even other costs that are, well, maybe not covered by the original Medicare, stuff like dental, vision. Because all the plans are different and there are many insurance companies with different plans, it's my opinion that dealing with an insurance broker is almost always going to be your best option. Much better than just calling an individual's insurance company. If you're an insurance agent or considering getting an insurance license, allow me to share 4 reasons that you should absolutely consider about selling Medicare Advantage through our national insurance marketing agency. Now that you understand original Medicare versus Medicare Advantage. First off, our insurance agents are 100% independent and in no way captive agents, which means You are vested on the very first day, paid full commissions by the insurance companies, and what that means is we don't like take part of your commission or share your commission or anything like that. However, a lot of insurance agencies do actually do that. Beware. Some of the largest insurance agencies are recruiting agents, and what they do is they tend to hide the fact that they not only take some of your commissions, but they're also taking part or all of your lifetime residuals. Pretty shameless. Second, we have the most intensive and extensive training platform in the industry, including the ability to get you face-to-face and in the car with one of our top-producing insurance trainers. There's nothing like hands-on training while you're doing a ride-along with someone who is a total master at the art of being a Medicare insurance professional. Most companies cannot do this, and if anything, we'll just connect you with an agent who is like average and in no way can show you how to make like 10 to 15 sales every week. 3, we do something that you will rarely hear of elsewhere. I don't know of anyone else doing this actually. For agents that are willing to commit to us, we're willing to commit to them with a $75 lead credit for every single Medicare Advantage plan that you sell. So what that means, all you have to do is sell the average number of leads, which is 1 out of 3 of your exclusive, 100% exclusive direct mail leads. And by doing this, by just being average, you may never have to pay for leads, ever. And 4th, did you know that Medicare Advantage pays a lifetime renewal every single year for every single client that you sell? The annual renewal pay is $287 every year starting in 2022. And guys, there's more. As of 2022, when you enroll a brand new Medicare recipient into their very first Medicare Advantage plan, the first year commission is $573. So when you add that to the annual renewal commission of the $287 that I mentioned each year, a great example of how much money you'll make is to take a look at your client that stays with you for 10 years. Your total commissions over that 10-year period for that very one client is $3,156. Through our direct mail leads program, we have insurance agents that sell 10 to over 15 Medicare Advantage plans every single week, all year long, week in, week out. Medicare Advantage is not just an amazing benefit for our clients, but by selling them, you're not only, 1, doing something good for the client and their family too, but 2, Medicare Advantage sales is the ultimate vehicle for that lifetime passive income stream. For more information on earning a 6 or even 7-figure income through Medicare Advantage sales, just email me at doug@ufesonline.com, or you can call us direct 888-501-1375. Remember, when you put the needs of your clients first, everything else will usually fall right into place. Now, get out there, guys, and do something good for someone today. Happy hunting.